dear members of the committee, dear members of the audience, my name is Rita Vajna. Let me introduce my 9-month project progress. The title of my big PhD topic is Clinical Pathophysiology of Polycystic Ovarian Syndrome. I am an obstetrician gynecologist in the Semmelweis University, Obstetrics and Gynecology on the Barrow Street Department. My mission is finding the best therapy option for higher ovulation rate, endometrial thickness and pregnancy rate in women with PCOS. My vision is, with the best therapy, more women with PCOS can have a child. There is my specific goals. The title of my first topic is Strong Early Impact of Letrozole on Ovulation Induction Outperforms Clomiphene C-treat in Women with PCOS. First, I would like to speak a little bit about the background. The incidence rate of PCOS is between 3 to 10%. The PCOS is the number one cause of infertility. The most important problem with this, the high testosterone level, which leads to irregular periods and infertility. We have two options for follicular stimulation. The first one is Clomiphene C-treat. This is an estrogen antagonist, but this drug has many side effects. The most important is an anti-estrogen effect, rich endometrium thinning. We have an alternative options. The name of this drug is Letrozole. The patients tolerated it better, and the pregnancy rate in Letrozole group is significantly increased compared to Clomiphene C-treat. My clinical question is Letrozole superior to Clomiphene C-treat in treatment of infertility in PCOS patient? This is my PICO. I made the systematic search and with the following search key. This is the flowchart of selection. Finally, I found 25 eligible full text. I have several outcomes. I would like to introduce my first figure. This is the forest plot of endometrial thickness. We can see that when a patient uses letrozole for ovulation induction, in this case, the endometrium will be significantly thicker than a patient uses Clomiphene C-treat. This is good for us because when the endometrium is thicker, in this case, the embryo implantation will be better. The second figure is forest plot for ovulation rate. We see that when a patient uses letrozole for ovulation induction, in this case, the ovulation rate will be bigger than a patient uses Clomiphene C-treat. The third figure is forest plot for pregnancy rate. We can see that when a patient uses letrozole for ovulation induction, this patient have bigger odds for pregnancy than a patient uses Clomiphene C-treat. My fourth figure is forest plot for resistance index, and the 5 is forest plot for pulsatility index of subendometrial arteries. We can see that when a patient uses letrozole for ovulation induction, in this case, the resistance index and pulsatility index will be lower than a patient uses letrozole. And this is good for us because when the subendometrial circulation is better, in this case, the embryo implantation will be better. I have strengths and limitations too. I have only RCTs. And this is the first meta-analysis to comprehensively assess to resistance index and pulsatility index of subendometrial arteries. The limitations was no sufficient data on live birth rate and different diagnoses across the studies. The conclusion is thicker endometrium, higher ovulation and pregnancy rate, and better subendometrial circulation was in letrozole group compared to Clomiphene C-treat group. This is my manuscript status. I send it my manuscript to internal review, and I'm waiting for some remarks from my co-investigators. The journal is Fertility and Sterility. I would like to send my manuscript to this journal. The impact factor is 7.49. This is a good journal. The title of my second topic is Investigating the Efficacy of Natural Products on Metabolism and on Endocrine Status in Women with PCOS. The background is very similar to my first project. PCOS affects 1 in every 10 women worldwide, and the most important problem with this, the hyperandrogenism, and finally it cause insulin resistance and infertility and diabetes mellitus. The first-line treatment is metformin. We use that since 1994, but this drug has many side effects too, and we have an alternative options to enhance the positive metabolic and endocrine effect of metformin. There are the natural products. And we hope that when these natural products can enhance the positive effects of metformin, less metformin might be sufficient. Our aim is to compare the effects of natural products to metformin or placebo regarding to metabolic and endocrine status in PCOS patients. Our question is, can natural products improve the metabolic and endocrine status of PCOS patients? This was my PICO. And our clinical implication is natural products as an effective therapy to improve the metabolic and endocrine status in PCOS patients. I made a systematic search with this search key, and at the moment I make the full text selection. My topic is feasible. I made the Prospero registration, the duplicates removal, and title and abstract selection too. Yes, and thank you for attention. What you can't explain simply, you don't quite understand. Thank you very much.
Thank you for your presentation. I'd like to ask which natural product had the most RCTs conducted?
Thank you for the question. With cinnamon, have we lots of RCTs. The cinnamon can reduce the glucose level, the testosterone level too, as this is a good natural product. Thank you very much.
Thank you for the nice presentation. I would like to ask one question. So, does letrozole in daily practice or only clomiphene citrate, or we are waiting for to use letrozole in the practice?
Thank you very much your question. Yes, at the moment we are waiting for this drug. We would like more big RCTs about this drug, and at the moment we use only the clomiphene citrate in the everyday practice.
I also would like to ask a question on this topic. So does letrozole have an indication against PCOS in Europe, or it's just an off-label use?
At the moment I read that this is off-label at the moment, and we would like that in the first line.
Okay, thank you. Maybe based on your studies also. Thank you.
Thank you very much.
And I would have a question regarding your first topic as well. Is there a background explanation to why letrozole increases pulsatility and resistance index more preferably compared to clomiphene citrate? What is the mechanism behind that favorable effect?
Thank you for the question. I don't know why, and that I don't know. Thank you very much.
Okay. Thank you very much.
Thank you very much for your presentation. Maybe I missed that point. I just want to ask regarding the first project and the two drugs compared. What about the adverse events, adverse effect? Did you evaluate also this, and is there any difference? Thank you.
Thank you very much. The most important problem with the clomiphene citrate, the endometrium thinning. This is a very big problem because when the endometrium is thinner, the embryo implantation is not too good. Therefore, we would like to find a new drug, and the letrozole is with letrozole is the endometrium thicker, and this is good for us, good for the embryo implantation. Thank you very much.
Sorry, Rita, but the question was you examined the side effects either for letrozole or for clomiphene citrate. Did you examine the side effects, or you did not deal with them?
The side effects, no.
Okay.
No.
Thank you for the presentation. My question is about your second project. So if I understand your hypothesis that natural products enhance metformin's effects or aid it as a supplementary therapy. Yes. But when you were showing the comparison, it looked like some studies only use natural products. So can we draw conclusions based on those studies for the first thing? So only using natural products has the same sort of additive effect as using those as supplementary therapies? Thank you for the question. The natural products is better than placebo. This is very good for us, and we hope that we can reduce the metformin dose too with the natural products. And only with natural products we can give better labor parameters than a patient who doesn't use any natural products. Thank you very much.